guys, I want to share a story with you about how my brother injured his shoulder. Because it's a great example of what happens when you don't do the right things when you injure your shoulder and ignore what everyone says. So my brother and I have this ongoing fight to see who's stronger at the gym. And, you know, as brothers do, we were working out one day and I kick his ass all the time. He was trying to keep up with me and he felt a twinge in his shoulder when he was doing an overhead exercise. And once I'd stopped giggling my ass off at his expense because I knew exactly what he'd done, I told him that he'd done a slight tear to his supraspinatus tendon, which is a pretty common injury to do with shoulder work. As a side note, with shoulder injuries, if the stability of your shoulder and your scapular stabilizers aren't strong enough, it's very hard for you to do anything at all with your shoulders, because if there's no stability, then it's very easy to traumatize some of the areas of your shoulder. So my brother, this happened to my brother because the foundational support and stability of his scapula weren't strong enough to deal with that overhead exercise. But the same is true for, say, if you've got weak stabilizers and you're typing all day, you can still cause damage and trauma to your shoulder. You don't necessarily have to be doing stupid things at the gym to cause an injury. Yeah, so getting back to my brother. So he'd done a slight tear to his shoulder. I laughed and laughed and laughed. Told him, look mate, come in, it's going to take a bit of work, but we'll get this under control pretty quickly. He decided not to, and to just let it settle on its own. It'll go away, don't worry about it. Now, what happened was the pain went away and the slight tear re-knitted itself, but he didn't do anything to address the scapular stability issue. So sure enough, went back into the gym, he went to try and do the same thing, caused an even bigger tear, and then that settled, and then didn't do any therapy for it. Went back to the gym and he's just getting worse and worse and worse and worse, and now it's 12 months down the track and his shoulder is still giving him grief because he doesn't listen to me. What an idiot. So I thought it'd be a good idea to talk to you about what the standard evidence-based approach to shoulder rehab is. So whether you're seeing a chiro, a physio, acupuncturist, massage, whatever the case may be for your shoulder pain, the reality is you should probably be seeing all of the above if you want to get really good results. Chiro can do some really good with some shoulder injuries, so does physio, but they approach things in a different ways. You should see some form of improvement over about a 3 or a 4 week period. So you might find you're a little bit stronger, or the pain starts to lessen, or you feel a little bit more mobility. You can move your shoulders around a little bit more. But as long as you notice something over that month period, you're on the right track. Let's talk worst case scenario. So let's say you get to the end of the month, nothing's changed. Your next step is medication, so anti-inflammatories. That's when you need to talk to your GP about getting some imaging done, so an ultrasound, a CT scan, or an MRI, as well as some anti-inflammatories to help calm it down. Now again, worst case scenario, that didn't work. The next level up is a cortisone injection. So both the anti-inflammatory and the cortisone injection have a similar mechanism. They help to calm down a lot of the swelling and inflammation in your shoulder so that the therapy that you're getting becomes a lot more effective at healing your shoulder. So again, worst case scenario, if the cortisone injection didn't do it, unfortunately, we should be considering surgery as an option for you. Because if all of that didn't work, then it's a fairly significant issue and we need to get the surgery to knit you back together. Now, if you have had surgery for your shoulder, it's important to realize that that bedrock foundation stability issue of your shoulders is still there. So all the surgery did was to correct the trauma. It hasn't fixed the problem that caused the trauma in the first place. So that's where it's important to go back to your physio, your chiro, PT, whoever, but look at someone who can give you an exercise routine to help strengthen up your imbalances around your shoulder so that this same problem doesn't come back and come back and come back like it has with my brother. Now, in a separate video, I'll run through some of the most common or my favorite exercises to help strengthen up the shoulder. So keep an eye out for that one. But otherwise, look, I hope you found this informative and you now know what the standard approach to the worst case scenario for shoulders is. But if you've got questions about your shoulders and you want to talk to someone about it, give us a call, 9817-6611. We can see if we can help you or at least point you in the right track. So yeah, thanks for watching.